Welcome to Angel Health Academy. Topic for the session or topic for the day is functions of management. Management is the process. It is a series of steps or number of steps that includes planning, organizing, leading and controlling the resources. That includes human resources, financial resources, that is budget, and physical resources such as equipment and materials. And in addition to that, the information resources. Thus, management is the process of planning, organizing, leading and controlling the resources to achieve the or accomplish the organizational goals or objectives efficiently and effectively. So, this management process mainly includes POLC, that is POLC, planning, organizing, leading or directing and controlling. That is coordination and control. Okay. Now let us see the definition of management. According to Gulick, management is the art of coordinating various elements of an organization. So there are many elements in an organization. Okay, that has to be coordinate. Okay, so it is the art of science and art of coordinating various different elements or aspects or components of the organization, such as its people, okay, employees or workers, its other resources, material and equipments, and the process it functions, okay, in order to achieve, okay, in order to fulfill or in order to accomplish its objectives efficiently and effectively. Okay, all the organization may set the goals and objectives. Okay, at the end it has to be achieved or it has to be accomplished. Okay, thus to accomplish the objectives of an organization, it has to be coordinate. All the aspects or elements has to coordinate. So it is an art of coordinating various elements of the or an organization, that is its people, resources and process, in order to achieve its objectives efficiently and effectively at the end. Gulick also emphasized, okay, that management involves specific functions, okay, that is necessary to guide the organization towards the achievement or towards the accomplishment of their goals and objectives. So he emphasized the different specific functions. These functions are encapsulated. Okay, he made an acronym. Okay, that is known as Gulick well-known acronym, that is POSDCORB. So the functions of the management according to Gulick, it is POSDCORB. Okay, in this video I am going to talk about the functions of management according to Gulick, that is POSDCORB. Thus, in this view, POSDCORB view or according to Gulick, management is seen as a systematic process. So it is a series of systematic steps, okay, scientific or systematic process of decision making the logical decision by the management or managers. Then resource allocation, that is providing or issuing or making available of the needed resources, that is man, money and materials. Then maintaining leadership, direction, okay, motivation and communication among the workers, that is leadership, okay, leading them, okay, that all ensures the smooth functioning of an organization, okay, so the efficient or effective functioning of the organization and thus achievement or accomplishment of its aims or objectives. In short, the management is a systematic process of decision making, resource allocation and leadership for the smooth functioning of that particular organization and thus for the achievement of its aims and objectives. Thus, the functions of management are actually, it is the essential activities of the managers of the organization. Okay, so the function of management is nothing but it is the essential activities or functions of the managers of the organization to run an organization efficiently, effectively, smoothly to achieve its goals and objectives. So the function of management is nothing but it is the essential or very important activities or functions of the manager of the or managers of the organization or institution to run an organization or to function an organization efficiently and effectively, thus to achieve its goals and objectives, set goals and objectives. Now let us talk about the functions of management according to Gulick. as we already said that it is POSDCORB. So now you know that management is a series of systematic process or series of or number of steps. Okay, that is starting from P, that is planning, then O, that is organizing, then S, that is staffing, then D stands for directing, it is also called leading, okay, directing, and C stands for coordinating, and R stands for reporting, and B stands for budgeting. Okay, this is about the acronym of POSDCORB made by Luther Gulick as the functions of the management or essential activities of the managers. So POSDCORB includes planning, organizing, staffing, directing, coordinating and controlling, reporting and budgeting. Okay, in this video we'll discuss in detail about this elements of the administration, that is POSDCORB or functions of the management according to Luther Gulick. The first function is P, stands for planning. Okay, planning is the primary function or first functions of the management. As you know that POSDCORB starting with the P, that is planning. It is a primary functions and first preliminary functions of the management. It involves deciding or determining in advance. Okay, before the organizing an institution or organization, we are deciding. Okay, we are planning. That is, planning involves deciding in advance, okay, before the occurrence, in advance, about what to do, okay, what are the things has to do in the organization, okay, when to do, okay, when it has to be done in the year, okay, then where to do, okay, area, okay, where to do, then how to do, okay, how to do the functions in the organization, and last one is who to do, okay, who are the people is necessary or needed to do this function of the organization. So planning involves deciding in advance about what to do, when to do, where to do, how to do and who have to do or who to do. Definition of planning. Planning is the process, okay. So all these elements are the or functions are the process, series of steps, okay. Planning is the process of identifying or setting objectives, okay, goals, and based on the goals, objectives. So it is the process of identifying, finding out, okay, and setting various objectives and determining and deciding the best course of action, measures or activities or functions, the best, okay, that is the best functions, best activities. So set of best activities is called the best course of actions that is needed to achieve those goals, that is we are already set, okay, goals and objectives. So planning involves a process of identifying or setting various objectives based on the goals or setting the goals and objectives and determining, finding out the best course of the actions or deciding the best course of actions or activities or functions that is needed to achieve or accomplish these goals, set goals at the end, okay. So now we can discuss about the key steps of planning or key tasks in planning, okay. It includes establishing organizational objectives. So each organization is having its specific goals and objectives. So first, during the planning period, it has to be set. So that is called establishing or making or setting organizational objectives. So the organization functions according to its objectives. Then second one is developing strategies. So we have to make a set course of actions, activities or functions based on the objectives. That is developing strategies. That is nothing but short-term and long-term measures or activities or functions to achieve the objectives or goals. Then third task is forecasting the future conditions of the organizations. So in advance understanding or forecasting, okay, regarding the future condition and future situation of the organization. And fourth task is outlining various tasks, activities and its schedules when it has to be done, okay. So outlining the number of activities and making schedules when it has to be done, okay. So these are the four key tasks or steps in planning: establishing the organizational objectives related to the goals, developing strategies short term and long term according to the objectives and goals, and forecasting the future situation or condition of the organization and planning according to that. And last one is outlining various activities or tasks and schedules when it has to be implemented, okay. Now the second function is organizing. O stands for organizing. Organizing is also the process, okay. It is a process of arranging the resources that is necessary to run the organization. Arranging the resources such as human resources, financial resources, capital or budget, that is money, and physical infrastructure, equipment and material, that is physical. So it is a process of arranging the various resources, man, money, material, to implement the plan effectively or efficiently. So organization is the process of arranging the resources to implement the plan effectively and efficiently. That is bringing together the manpower and material resources for the smooth functioning of the organizations. Bringing together, collecting and having in hand all the manpower. Manpower is nothing but personnel, employees or staff. And material resources, it includes physical infrastructure and supplies and equipments. Then organizing also refers to arranging the resources and tasks in a structured way. So we said arranging resources, arranging these resources in a systematic way or a structured way to accomplish, to achieve the objectives that is we are already set during the planning step. So organizing is the process of arranging resources, that is bringing together the manpower and the material resources for the organization, or it refers to arranging the resources and the activities in a structured format or in a structured way to accomplish or achieve the objectives of the organization. The key tasks in organizing include, first one is defining the various job roles, okay, job and their responsibilities. Defining job roles and responsibilities of the employees or the personnel. Then second one is delegating authority or delegating the responsibility to different departmental head or managers. That is delegating the authority to the workers. Then third one is establishing a chain of command, okay. That is the mode of communication, okay, who are the superiors and who are the subordinates, who has to given the command in the organization. So establishing a chain of command and mode of communications, that is upward and downward communication, and command and order that has to be given by the managers. So establishing a chain of command. Third one is coordinating the activities, coordinating all the activities of the different departments. Then fifth one is allocating the resources, okay, providing or supplying the needed resources, man, money, material, based on the objectives and goals, manpower, budget and physical resources, infrastructure and supplies and equipments. So these are the 5 important key tasks in organizing or step in organizing. Defining the job roles of the each employee or worker and their responsibility, job description and responsibilities. Then delegating authority to the managers. Then establishing a chain of command or communication. Then coordinating the activities between the departments and between the different sections of the organization. And last one is allocating the needed resources, man, money, material. The third function, S, stands for staffing. Staffing involves or includes recruiting the personnel, okay, hiring the personnel from the external recruitment agency, then training the personnel, training the staff, and retaining the skilled personnel or staff in the organizations. So keeping for a long period, okay, that is a retention, to fill the roles within the organization to perform. So staffing is nothing but it is recruiting, hiring, training and retaining the skilled personnel or the workers or the staff to fill the roles that is already planned within the organization to accomplish the goals and objectives. Then staffing is also called manning the organizational structure. So organization have it is organization structure from top level to bottom level. That level executives, middle level managers and lower level the workers. Okay. So filling all those people in the organization is called manning. Okay. So manning the organizational structure of the organization, it includes recruiting, hiring, training and retaining the staff by giving motivation and incentives. The task for the staffing or staffing comprises of or it includes various steps such as one is manpower planning. So first we have to plan how many number of workers or personnel are required, employees are required. That is comes under manpower planning. Second step is recruitment. Okay, from the external or internal authority or recruitment organization, we have to get the suitable personnel or the staff. So recruitment of suitable based on the objectives of the organization, suitable personnel or staff. Third one is selection of most suitable candidate from the recruitment process. During recruitment, during interview, we have to select the most suitable candidate for the organization to accomplish its objectives. So selection of most suitable candidate from the recruitment process. Then proper remuneration, okay, giving proper salary or wages to the staff. Promising the proper remuneration based on the designation of the worker, okay, based on the position of the worker in an organization, that is proper remuneration, okay. Then placement and orientation of the employees or personnel or workers. Placement and orientation, so maybe a manager, okay, so maybe a technical expert, so according that he has to be placed. Then followed by placement, we have to give an orientation about the program of the organizations, okay, orientation about the department, orientation about the executives, functions, infrastructure, etc. related to the organization, that is placement and orientation program for the employees. Then periodical training, in service education and other training, okay, periodical training and development, staff development or manpower development programs and other welfare programs. So proper training and developmental programs, okay. Then seventh one is performance appraisal and evaluation, periodical monitoring of the or checking of the performance of the particular staff or the personnel, okay, periodical monitoring and evaluation of their activities, whether it is based on the objectives of that or based on the common interest of the organization or individual interest. That includes performance appraisal and evaluation. I have already uploaded a video regarding performance appraisal, what are the different methods used in performance appraisal. Then eighth one is transfer and promotion. So transferring the employee or the worker from one area to another area, one branch to other area, or giving promotion to lower post to higher post, okay, transfer and promotion. So these are the 8 important steps involved in staffing or the key tasks involving or including in the staffing, okay. Then fourth function is D. D stands for directing or leading the employees, directing or leading. Directing or leading is a process of motivating the employees and guiding employees to meet the organization objectives or goals. So our ultimate aim is to achieve or accomplish the organization objectives. For that we have to prepare all the workers through the motivation and guiding and supervising, okay, and even training. So directing or leading is a process, a series of steps, a number of steps of motivating different techniques of motivation to the employees and guiding, supervising and training the employees to meet the organizational objectives or goals. So it is nothing but it is an art and process of getting the things done. We are already planned, we are organized, we have done the manning in the organization. Now our strategies has to be implemented. For that we need direction and leading of the employees or manpower, okay. Thus directing or leading includes the art and the process of getting the things done effectively and efficiently to achieve the goals. Then this also involves issuing the orders or command to the employees, okay. Supervisor, of course, we give the orders to the subordinates. So it involves issuing the orders, commands and even influencing the behavior of the team to work as a positive attitude all the subordinate staffs to attain the organizational goals and objectives. So direction or leading also includes or involves issuing the different orders to the employees and moreover influencing the behavior of the total team members, total workers, that is the subordinate staff, by the supervisor to attain the organization goals. The task or key tasks in directing includes motivating the employees with various motivation technique, motivating the employees, maintaining good and clear communication, okay, transparent communication effectively from lower level to upper level, maintaining communication effectively. Then third one is providing leadership, supervision and guidance, leadership and resolving if there is any conflicts or problems among the employees, okay. A manager of course resolve the conflicts and frustration among the employees, okay. So providing leadership and resolving the or solving the conflicts or any issues and disputes between the employees or among the employees. Then fourth one is fostering a teamwork and collaboration. So fostering, promoting a teamwork, we feeling, okay, and collaboration of all the departments together. Okay, work together. So fostering teamwork and collaboration. And the last task is inspiring. Okay, inspire the employees, and coaching if it is required to the employees by training and supervising. So inspiring and coaching the employees to accomplish the organization objectives and goals. So these are the important 5 tasks comes under directing. Okay. The fifth function of management is C. C stands for coordinating. Okay. Coordinating all the activities in the organization. Coordinating refers to harmonizing, okay, and aligning, okay, balancing the activities, okay, that is work together by all the employees of different departments and sections. Of course, you know that an organization may have different departments, okay, purchasing department, human resource department, okay, technical department, like that there are many departments, okay. These all the department has to function coordinatively, cooperatively and harmoniously, okay. Then only we can balance we can achieve the objectives of the particular organization. So coordinating refers to harmonizing and aligning the activities or work of the different departments or section to achieve the organization's objectives without any conflict or without any duplication of the effort. Okay, all the people has to do their own roles and functions. Okay, for that we need a cooperation and a collaboration and coordination between and among the various departments. It is done by coordination is done by facilitating the communication. So transparent communication between the department, and it is also done by making different controlling measures in the organizations. That means coordination lead to controlling. Okay, and controlling also important one function in the organization that comes under coordination or coordinating. Okay. So the key task in coordination in management, okay, for example, management, first one is to facilitating the communication between the nurses, doctors, other therapists and other healthcare professionals. Okay, so facilitating the smooth and transparent, clear communication about the patient and patient healthcare needs. Okay, that is between the nurses, doctors, therapists and other healthcare professionals. Like that in any organization, facilitating the communication among the various departmental heads and other employees. Then ensuring the continuity of care during the patient transition. That includes shift changes of the staff and patient transfer from one department to other department for various specialty services. So ensuring the continuity of care in the department according to the different the shift. Okay, that also through transparent and smooth communication. Okay, ensuring continuity of the services or quality services. The last one is involving patient and families. Okay, through public relation, involving patient and families in care planning and decision making to render the comprehensive patient care. Like that in an organization, involving all the departmental heads and the employees in all the level, that is lower, middle and top level, and with the public relation to achieve the goals and objectives of the organization. So the key task in nursing management in relation to coordination include facilitating communication, ensuring continuity of the services or care, and involving the patients and families or public in completing or fulfilling the goals and objectives of the organization or healthcare setting. Then as I said, coordination is also included controlling. Controlling is nothing but it is a process of monitoring and evaluating the progress of an organization towards the achievement of its goals. Then ensuring that or making sure that the organization's performance, okay, the performance of all the people in the organization, which aligns, which balance with the set objectives and goals. So all are moving according to goals and objectives to achieve at the end. Okay. So controlling is nothing but it is a process of checking, inspecting, periodical inspection or monitoring and evaluating, okay, the progress of each person or the progress of the total organization towards achievement of its goals and objectives, and ensuring that the organization performance is that goes along with the or aligns with the or balance with the accomplish or achieve the set objectives. Thus, it involves monitoring the performance of the personnel or organization to ensure that the organization is on track. It is going in the right track to meet its objectives and goals. The key tasks in controlling include one is setting the performance standards for all the people in the organization. So, to achieve the goals, there should be set standards or uniformity. So, first is setting the performance standards, and each employee has to follow that standards. In nursing, we have professional standards. It has to be supervised by the ward in charge or nursing superintendent. Like that, all the managers in the organization has to periodically do the performance appraisal, and with that they have to check the performance standards of the persons and total organization. Second one is measuring and comparing the actual performance of the people or employees or the workers or the organization against the set standards. So we have to measure the actual performance and compare with the set standards. Okay, if it is necessary, we have to correct. Then third key task is identifying the deviations or shortcomings occur among the employee during their performance. If so, implementing the corrective actions with the punishment or with the motivation, with the guidance, supervision, etc. Okay, that is implementing corrective actions to achieve or accomplish the organization goal or objectives of the particular healthcare setting or healthcare organization or the general organization. Thus, there are 4 important key tasks in controlling. First one is setting performance standards. Second one is measuring and comparing the actual performance with the or against the set standards or performance standards. Then third one is identifying any deviations or any shortcomings or problems or issues to follow the standards and quality of the organization. The last one is implementing the corrective actions if it is necessary to achieve the objectives or goals of the organization. Then sixth function is R. R stands for reporting. Okay, reporting is nothing but it refers to keeping the supervisors and the stakeholders, management, top level management, executives, okay, informed about the progress of the organization, about the developments of the organization, about the various problems and issues occurs during day-to-day activities in the organization. So that is within the organization through proper records, proper reports, through making research and report of the inspection or report of the performance appraisal, and through proper communication through different communication channel from top to bottom or from bottom to top level. Okay, so reporting refers to keeping the supervisors of the organization, managers of the organization and stakeholders, that is board of directors, top level management, that is executives, okay, informed periodically or regularly about the progress of the organization, developments which made in the organization, and various issues and problems they are facing, okay, or workers are facing within the organization through records, periodical submission of the or maintaining of the records and reports, then by conducting research in different department, and by making survey or inspection or audit, and through proper communication with the different communication channels. So reporting is nothing but it is keeping the executives of the organization informed about what is going on in the organizations, whether it is development or whether it is some problem or issues, everything, okay, and make solution according to that. So keeping the executives informed of what is going on in the organization is called reporting. The key tasks in reporting, first is collecting the data, okay, from different department or from all the department, okay. So collecting data, then generating the reports based on the data, okay, departmental report, monthly report, annual report, etc. Then ensuring the transparency of communication of this report to the higher authority, the stakeholders or the executives or board of directors of that particular organization. So the key task under reporting includes collecting data, generating reports, and ensuring the transparency in communication of the data to the executives or board of directors or to the managers of the organization. The last functions of the management is B, that is stands for budgeting. B stands for budgeting. Budgeting involves managing the financial resources, okay, required for the smooth functioning of the organization. As you know that without money, without budget, without capital amount, organization cannot run, okay. So budgeting is a plan, okay. It involves managing the financial problems of the organization, that is financial resources for man, money, material, okay, required for the smooth functioning of the organization, okay, and at the same time ensuring that the department operates within its financial limits. So every department is already set its budget for the particular year, okay, financial year, okay, they have to function according to that, okay. There should not be more expenditure or there should not be any liabilities, okay. It has to be managed. For that, each department has to plan the budget. Okay, so thus budgeting involves managing the financial resources required for the smooth functioning of an organization and ensuring that all the department or sectors operates or functions within its financial limits or without making any liabilities or trying to make the profit for the institutions. Thus budgeting involves, first one is auditing, checking, okay, inspecting, then accounting, getting the amount or getting the budget, okay, or capital, then making a plan, fiscal plan, that is making budget, and controlling the expenditure, that means using the health economics, okay, with minimum resources, maximum benefits, okay, that is a policy for the organization. Thus budgeting involves auditing, accounting, fiscal planning, and controlling of the expenditure. The key task in budgeting includes, one is allocating the financial resources. So whatever required amount has to be allocated, okay, that has to be issued, that has to be provided to the organization to spend in different needs of man, money and material. Second key task is monitoring the expenditure of the each department and adjusting the budget based on the expenditure and income of the organization. Then third one is controlling the cost, purchasing cost of the material, okay, all other cost or expenditure in the organization, that is controlling the cost. Last one is ensuring that the funds available are used efficiently without any wastage, okay, ensuring that the fund or budget are used efficiently and effectively to achieve the or accomplish the goals and objectives of the organization. So there are 4 important key tasks under budgeting as the function of management. The first one is allocating the needed or necessary financial resources, okay, budget, then monitoring the expenditure of various departments and adjusting the budget if required, okay, then controlling the expenditure or cost in the organization, then ensuring that the available funds are used efficiently and effectively. So thanks for watching. So far we have discussed one of the important topic in nursing management and administration or nursing administration. Hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel and stay tuned with the Angel Health Academy for the next and important academic video. An important thing is, don't forget to convey your regards in the comment box. And once again, thank you for watching my video. See you and take care.